just going to take a quick look at Cigna's history and story. One of the things that folks just love to hear is the long-standing history that Cigna's had in America. If you look at INA, which is Insurance of North America, they were founded in 1792, making Cigna the oldest insurance company in America. Now, Connecticut General was incepted in 1865, and then those two companies merged in 1982, and that's where you get the CIGNA of Cigna. Now, here's a note. If you guys are taking notes, this is a strong one. So when you're speaking to folks on the phone, one of the things that stands out is Cigna stability. We've been serving Medicare beneficiaries here in the Valley for over 40 years. Okay, so it's a great story looking at the oldest insurance company. But what relates to them is letting them know about the stability here in the Valley with Cigna. Another very strong piece, and this one's good for agents, all of you guys, knowing that the company that you're placing your business with is very diversified. That's all the more important in today's volatile Medicare environment because cuts and changes are happening, and you've got to have a strong foundation to keep going. That is one of the things that Cigna does have. About 15 years ago, Cigna took a focus overseas and started to grow their expatriate benefits, and they did so very successfully, making Cigna one of the largest global insurance companies in the world. We have over 30,000 employees, and we're in over 30 countries with over 70 million members. Now, let's draw our attention to the bottom of the screen and look at the focus on Medicare. I mentioned 15 years ago where our focus was increasing our expatriate benefits, and then about 3 years ago, Cigna said, we want to look right here in the States. We have a large commercial block of business, that's employer group, and a lot of them are turning 65. And back then, before 2012, this one little town, Maricopa County, I wouldn't say little, but Phoenix, Arizona, was the only Medicare Advantage offering in the whole country. So then, Cigna started to look at HealthSpring, whom you guys know very well. In 2012, Cigna spent $3.8 billion to acquire HealthSpring, which would let us grow in that Medicare space of Medicare Advantage and prescription drug. Below that, right behind that acquisition, was Great American Supplemental Benefits Group. That allows us to have license to write Medicare supplements in all 50 states, again, showing you the focus and the growth and investment into our Medicare. And then thirdly, at the very bottom, Cigna Medical Group, you guys know that's the foundation of our network. It's been here in the Valley for over 40 years. They're freestanding medical facilities that Cigna owns and operates. And in 2012, December of that year, we opened our state-of-the-art 90,000 square foot location called Phoenix Central. It's beautiful, it's state-of-the-art, it's right in the middle of downtown. Everyone comes there. So again, showing you more investment into the Medicare focus. Now you may ask about Cigna Medical Group. We do offer those services to other employer groups, but here's the note. 80% of all revenue brought into the Cigna Medical Group is through Medicare. So again, all three pieces focus on our Medicare growth. Now the next slide is just going to talk about our value proposition. We're a leading healthcare service company. Our mission statement is that we want to improve the health, the well-being, and the sense of security of everyone that we care for. And you guys know it. Everything we do is to improve the health of those that we see. The next one, the unique doctor-patient relationship. You guys know that. That's the physician engagement model that you've been hearing about all year, or you've known it for quite some time now. That's where the doctor and patient truly work together. There's a partnership for that patient's care and their overall health. Now below that, our network evolution. That's a 2014 campaign that you guys know about. What's our why? And one of the makeups of that is our how. I just mentioned it to you. It's the physician engagement. One of the pieces that support that physician engagement is we pay for quality, not quantity. That's a big, big differentiator here for us in Arizona. And then lastly, a team of high-quality healthcare professionals. Again, as I mentioned, our medical team, all of our clinicians, our plan, our sales team, everyone has the same goal and mission in mind, and that is to improve the health of those that we care for and our professionals are working together to deliver preventive health and staying on top of early detection, which will keep our patients more healthy, more happy, and keep them more active. Now, this next slide, we just want to take a quick look at this. This is something my boss, Rob Matura, he created this slide. We were doing a presentation to kind of show the full makeup of what our plan looks like. The illustration is a three-legged stool. These are going to be the pillars of our strength. If you look at the top, Cigna Medicare Advantage plans right here in Arizona are firmly set upon the top, right? Then go look at the far left. You can see that we have a stable, high-performing network, and it's in place and it is stable. There's a lot of disruption right now here in the Valley, but Cigna is being looked at highly because of that performing network that we have. Then over on the right, competitive benefits. Carrie's going to take us through a number of slides here in a minute, and you guys are going to be wowed with some of the things that Cigna's been able to do for 2015. And then at the bottom, not to be forgotten, maintaining lower medical costs is paramount. If you cannot do that, it will disrupt the whole stool. So we're going to take a little bit closer look at that in the next few slides. But for Cigna, we're standing solid on all three components. Now, as you see in this slide, if there's network concerns, that's going to weaken the stability of that stool. And right now, here in Arizona, this county that we're selling in, there's disruption. And there's a lot of doctors being termed. So they're against our competitors. We want you to know that when you're placing us with Cigna, you have a stable network, and you're probably going to be getting a lot of calls about, oh, I lost my doctor. So that's one of the big pieces here that you may be hearing more about. Again, that's going to weaken the stability of the plan, and it's going to lose value to the customer. Now look at the next slide. Here we're talking about the lower medical cost concerns. As we were talking earlier this year, 2014, we understand that our benefits were a little bit higher. Maybe there were some that were more competitive, but some of them were very irrational. And you've got to maintain lower medical costs with your medical loss ratio and so forth. And if you don't, it's going to spiral up. And again, that's another thing that's happened right here in the Valley with some of our competitors. So again, what does that do? That really disrupts the whole plan competitiveness, which is going to affect the benefits, which we're seeing. And also, it really weakens the value to the customer. As we finish, this final slide is where we began. The three pillars of strength that Cigna sits atop is our performing network, which is a stable, high-performing network, our competitive benefits, which we'll show you in a moment, and being able to maintain lower medical costs. This is a strong value to the customer, and this is Cigna's recipe for success. Now, what's our why? I believe most of us have been through the What's Our Why training and been able to see the video where Simon Sinek talks about selling from the inside out. Well, what do we believe? We believe that seniors deserve to live healthier lives, and everything we do models to that, from our doctors, our mission statement, and all that we do to interact with our customers. The second thing is we believe in health care, not sick care, and we're going to be able to demonstrate that to you in just a moment. And so as you guys are talking to your prospects on the telephone, be sure to let them know that Cigna believes in health care, not sick care. What does that mean? Well, the national average that a doctor sees a patient on a traditional fee-for-service is about 6 to 7 minutes. In 6 to 7 minutes when you're seeing a patient, you don't have the time to take a full picture and get a full look of the patient's health. You're just saying, what's ailing you now? I'll treat that, and then you're going to go. That's the traditional fee-for-service, is paying for quantity. How many people can get in and out of the door in a day? Cigna is completely different. That's why we believe in health care. We slow down. We start with a 360 comprehensive assessment, which is a 45-minute appointment that the doctor spends with the patient. And that's every year, folks. That's how we are proactive, and we get ahead of things that we can detect early. And then finally, we're going to look at that right now. It's our revolutionary model of care. That's what we believe in. It's called physician engagement. That's the answer to what's our how. So below the physician engagement, that's a wonderful thing, a note to take down, because when you're speaking to people and they say, hey, what makes it different, if you just want to insert that, it's the physician engagement model. It's really a profit sharing that we partner with our doctors to be able to give that more time, more resources, and also more incentives for them to care for patients with high quality. Really a quick statement as we've made, Cigna pays for quality, not quantity. And then right here, this 360 comprehensive assessment is a 45-minute where the doctor spends with the patient. That's where is a lot of tests, a lot of things are looked at, what's going on currently. We also want to look at their past medical history as well as their family history. Again, the big takeaway here is a 45-minute appointment where the patient gets to see their doctor every year. That should be mentioned to every prospect on the phone calls. The next one, focusing on prevention. All the plans throughout the country, they have these $0 screenings that their patients can get, but Cigna focuses on it, and that's one of the key aspects of being proactive. You focus on prevention, and you detect things early. We want to stay ahead of problems that we can forego. Next, what also makes us very unique in this physician engagement model is that we offer our doctors additional nurses and resources. It's very difficult for doctor, one, to have additional time, but then also to spend money they don't have to have the resources and nurses that they need. So we're going to take a closer picture, a look at that in just a moment. And then we do employ a team approach, depending on the individual's need, if they're managing a chronic condition, or if there's just preventive and other measures needed. It's not just our doctor. We have a team approach from other clinicians that are part of every patient's care. And then finally, there's that P for Q, Partnership for Quality. This is an awesome quality program that provides incentives and bonuses to our doctors, those that succeed in prevention, wellness, and disease management. You know what the result of that is? Better care and better outcomes for our customers. That's the power of this model. Now, as we were just talking about our how, which is physician engagement, let's look at some of the tools. The first one is going to be the data collection. We know how important that is, because how in the world are we going to measure one of our patients if we don't have the data collection to do that? We're going to start with a 360 comprehensive assessment, as we've just explained to you. If it's a 45-minute appointment, there's a lot that's going on. All of the different screenings, the well women's, the mammograms, the bone density, the vaccines, the glucose, all of the different checks that they do, the liver, the kidneys, the past medical history, it all has to be collected and entered into that data system for each patient. The Project 360 nurses, there are additional nurses that are able to conduct thorough chart reviews in advance before the customer even gets to the appointment with the doctor. And then also they keep track of certain conditions, and they watch for early detection of any diseases. That's huge, folks. I mean, here in the Valley, the doctors on the other competitor plans don't have these resources. So we need to be talking that up. That's a real big differentiator for us. And then we also have extra nurses, nurses in the hospital, and nurses for home visits. If a patient needs that additional care, they can assess their health at their living conditions and coordinate the patient's care if they're making a home visit. And then we also work closely with our hospitals. And then finally, you see that 412 report? That is for any one of our patients that haven't seen their doctor in 4 to 12 months. Our nurses are going to be reviewing those charts. And if they identify someone between that 4 and 12, they're going to make outbound phone calls and get them scheduled to get in to see their doctors. Again, I just can't speak enough about the resources. Excuse me. Still kind of getting over a cold from the weekend, but I can't put enough stress on these pieces here that really support what makes us so unique and different and valuable to our customers. All right, now let's take a look at the network. First, we want to show you the service area. So this is a map of the state, and you're seeing right down in the bottom a pink shaded area there. That's Maricopa County. Phoenix is one of the cities within Maricopa County, but it's huge, okay? So any zip code in Maricopa County will be part of the service area, but then those two little red shaded boxes, one is called Apache Junction, the other is called Queen Creek. Now there are certain zip codes not listed on the screen, but that are in your provider directory online and also your enrollment booklet, they're going to give you those exact zip codes. It is called Pinal County. It kind of straddles between Maricopa and Pinal, but just be aware that we do cover some of those certain zip codes in those areas. Now, we have over 550 primary care doctors. We have over 5,100 specialists, and we have 40 hospitals contracted. We have every hospital contracted in the Valley except for Mayo Clinic and except for the Cancer Centers of America. So that's pretty straightforward right there. Pretty much all hospitals are contracted. Another big note, because we've been talking about in the other our competitors' networks, hospitals is an issue. So you know with Cigna, there's that strong, stable network we've been talking about. And then Carrie's going to give us a full picture of the 4.5-star rating that we currently have for 2014 and more. Excuse me there. Now let's look at this physician engagement and organization. I'd like to draw your attention to the far left blue shade in the directional arrow called fee-for-service. This is the national way that folks pretty much operate their model and network. Move over one little scale to the right and look in the quality incentives section. That's the Partnership for Quality, and that's where Cigna of Arizona currently is. We started this process back in January 1st of 2013, so we're just under 2 years in this process here. Now that, as we had mentioned, our doctors receive these incentives based on the quality measures and the outcomes of their patients with these screenings. Now go to the far right. The ownership model is the end result. That is a full independent physician association that has a pod. That's where they will share in the risk and gains with our plan. Now look below that. Look at the duration where it takes about 12 to 36 months to move from left to right. In some cases, it may take longer. The reason that we mention this to you is that, again, we're speaking about our competitors right here in Maricopa County. Cigna is the only one on the track moving towards the right. So this disruption we're talking about, it's real, and it's happening. Carrie and I are getting tons of phone calls, so when you guys are talking about this, just keep going back to your basics, stable network, lower medical costs. Of course, you're going to have the competitive benefits, and then the model of care, which is in that physician engagement. Now, real quick, take a picture a couple of years ago, starting at the bottom. This is what it looked like in 2011. See that Cigna Medical Group? And you see the small band at the bottom of that funnel-shaped diagram? That's the primary care doctors that we had, that small line representing about 75 primary care doctors. Then the sides of that funnel-shaped diagram go up and out. That's the influx of the IPA doctors that we contracted with beginning January 1st of 2013. That's why you see those arrows with PCPs filling up the funnel, meaning that we're expanding our primary care doctor selections, our network. P4Q is the Partnership for Quality that we put on these doctors. They will eventually evolve in pods. So now that we're starting to fill the funnel, go to the separating line and go above. Now you see the funnel shape turns in, and you see some of the PCPs fall out. What happens here is that as we're measuring on the quality standards that we have in our network, in our contract, those primary care doctors that we contracted with over that 12 to 36-month duration will eventually move into a full share risk model with our company. And then some of the doctors, as you can see, that are falling out will not make it simply because we have to be stringent on our quality measures for each of our patients. Now look on the left. With this model, you see that membership arrow going up. We're going to increase our membership. And then look on the right. This is what we talked about. A key component of having stability is keeping your medical costs low. That's the whole goal, and that's the partnership that we have with our new network of doctors. Now this slide, I'm sure you're familiar with. It's taken right out of the Cigna in You flip book. On the left, it's just an illustration of someone saying, hey, I want the freedom to choose. I might go with a PPO, I might go with a Medicare supplement, but you know what? I get to choose where I go. Well, I have personal testimonies to this of folks that I've worked with here close to me, and it's not so great when you really need the care. It's okay if you're healthy and you're just traveling and everything, but if you get sick, if you get an illness, let me tell you, it can be a nightmare because you don't know where to go. You think you know where to go, and the time that you need the care, it takes much longer to get that care, and, you know, managing a chronic condition can be very difficult, and I've seen it. Now, over to the right, it's completely different. We don't leave our patients alone. They actually partner with our doctors, where the doctor, in a sense, is the quarterback of their whole team. So if there's specialists, if there's facilities, if there's hospital, the doctor with the degree in medicine is going to direct that care. That's totally different. That's an organized delivery system. Next, we're taking a quick snapshot of the Cigna Medical Group. This is the way that you describe the network. If you're taking notes, it's one large network with a choice between two groups for primary care. The first group for primary care selection would be Cigna Medical Group. We're showing you here a map of the valley and all the different little colored hearts and houses and crosses. Those are our medical facilities, and they all are different within the services that they provide. So some are very large, like number 10, the one I told you in the middle of the page, Phoenix Central. It's 90,000 square feet. It's 3 stories. It even has an outpatient surgery center in it. So the Red Cross is indicating an urgent care as well. But we want to let you know that if you were to go to number 17, all the way in the bottom right of the corner there, it's very different. It's a small satellite office where there's a doctor, there's a pharmacy, and there's the ability to draw the lab. So make sure that you're reading through this and saying, yep, I know exactly what services are available. They all kind of vary depending on their position within the valley. One thing to note, you see this over here where I'm waving my cursor, this little insignia, it says NCQA. That's the National Committee for Quality Assurance. And the Cigna Medical Group here that we're looking at right here, they've been recognized and awarded as being a patient-centered medical home. That's another thing I would mention on the phone when folks are saying, oh, you know, what should I do? Or what, you know, maybe you just insert that once you listen to them and find out what's important, and let them know that the patient is the center of everything we do. And we've been awarded so through the Cigna Medical Group through the NCQA. And then just let them know what that stands for, the National Committee for Quality Assurance. Next, here's a few more of those awards and recognitions that we received. Now, again, this is for the Cigna Medical Group. I want to draw your attention here. Can you see where I'm waving my cursor? It's the 4th bullet point down. It's the National Committee for Quality Assurance again, and it's something else. It's management excellence for diabetes. Okay? We have more doctors within the Cigna Medical Group that have received this award than all the doctors in Arizona. That is powerful. So take some notes there. If somebody's telling you they're managing a condition, whether it's diabetes here, bullet number 4, and the one right above it, heart and stroke, bullet number 3. Again, the doctors within the Cigna Medical Group have received more awards and recognition from NCQA than all the doctors in Arizona. That's a big piece. We're going to show you in a moment one of our Cigna HealthSpring Achieve plans, Achieve Plus plans, and that's for anyone that's been diagnosed with diabetes or congestive heart failure. If you're speaking to somebody about that plan, I would probably take notes and mention this right here. Now, let's kind of switch gears again. I'm going to say it again. We have one large network with a choice between 2 groups for primary care. We just showed you one of the groups, which is Cigna Medical Group. Now let's show you the second group, which is called our IPA, Independent Physician Association. These are non-CMG primary care doctors. Now, as I stated, in 2011, we had 77 primary care doctors to choose from. We have grown to over 450 primary care doctors just within the IPA, giving us a total of over 550 primary care doctors to choose from. So that network has expanded greatly. The map here is just indicating the doctor's offices throughout the valley. Now, in the makeup of the IPA doctors, these are the groups. They're very large groups throughout the valley, and they're listed here on the bullet points. Now, John and Gloria, Mark, there's several of you. Juan, I include on my email, so we send you an Excel spreadsheet. And the Excel spreadsheet, it lists out all of the IPA doctors, if your panel is closed, if it's open, accepting new patients. And then it also lists right here, Arizona Care Network, Abrazo, IASIS, and so on, so you can see the group designation for those doctors. Now below that, outside of these groups that are already in place, there's also some independent primary care doctors on that list as well. That's making up our full IPA doctor group. All right, so I'm going to take a break here really quick. I'm going to turn it over to Carrie to let us know about our quality.
Thank you, Anthony. Okay, next slide, Ann. As all of you, I'm sure, are all aware, we're a 4.5-star plan here locally in Arizona, and then CMS focuses on the high-performing, high-quality programs. Effective January 2015, CMS will no longer pay star bonuses to average plans. So these plans have got to be at least a 4 rating and above. Out here locally, we have 3 plans that are a 4.5. We, as well as you all know, have maintained that 4.5-star rating for 3 consecutive years. So we've got Blue Cross out here at a 4.5 and Humana at a 4.5 for 2014. Now 15, we should all know, I believe it's a 12, I think, when the 2015 star rating comes out. So again, we're very, very proud of maintaining this. As you all well know, you've been in the business a long time. It's very difficult to continually move up that ladder in star rankings, but we've done it. We've succeeded. We are so close. I mean, that's all I can tell you. I'm not sure. Our bosses told us we're right there. I don't know if we'll make it for 2015. Again, we'll find out. But I think 2016 is going to be our year. 5 stars is obviously our goal, and this is basically where we're at. I think we've done a star rating review, so I won't spend a whole lot of time on this. But just so that you're aware, there are 53 quality measures. There's a lot of measures that come into play with star rankings. 5 for the medical portion, 5 categories, I should say, and 4 categories for the standalone, the Part B program. But it's basically for the MA, it's the customer surveys, information from the physicians and clinicians, information submitted by the MA plans, results from regular monitoring, and reviews of billing and other information for the MA portion. Breaking it down further, staying healthy, how we manage chronic conditions, a rating of the responsiveness, the customer complaints, concerns, and then our customer service. For the Part B, basically the same, the customer service, the complaints, the experience with the drug plan, as well as the pricing and the safety. Now this is our CMG, but what's the most important to the agents out there is maintaining their client base without having to move them every single year. We are extremely proud of the patients that we have put in with our CMGs. The satisfaction rate has been extremely high. So agents that do stuff locally out here, they know when they put someone with Cigna, as long as they utilize the plan, see the quality that we provide, they stay with us. So retention is huge for a lot of these agents out here. So you should know that if you feel comfortable putting them, again, with the CMG, that most likely they're going to stay. So we're very proud. Basically, following the stars. We've talked to agents locally out here for the last couple of years, and now they're seeing it. Like Anthony had gone over, the stability of the plans, the ratings make a difference. We can push that quality, we get that star rating we need, we get that bonus, put it back into benefits, and we move forward. So I'm sorry, I keep getting a call. When people join our plan, they know that they're going to have high quality and get to maintain that. All right, we'll talk about our benefits. Have you guys got a sneak peek of our benefits yet?
Yes, yeah.
John?
Yes,
okay.
we did.
that, again, a lot of due to the merger and the acquisition of the plans together, we've changed our name. So the Cigna Medicare Select Plus RX, the standard plan, has changed its name to Cigna HealthSpring Preferred. The Cigna Medicare Select Diabetes, our chronic plan, has changed the name to Cigna HealthSpring Achieve Plus. Excuse me, my screen went away. And then we've added a plan, which is, this is basically an employer plan or exchange plan. It's not a plan that we're pushing. We're leaving it out there. Again, it's part of the exchange, but its name is Cigna HealthSpring Preferred Plus HMO, and it does have a premium that's built in this program. So in comparing 2014 to 15, the Cigna HealthSpring Preferred HMO in 15 will have a 0 premium. Out-of-pocket match, we decreased from $67 to $5,500, so that's a huge plus. PCP remains at 0. Specialist was a decrease to 30. Inpatient was probably one of the biggest, so we're real proud of this benefit. From $260 a day, we went to $190 a day, days 1 through 7, which is extremely competitive out here. Outpatient services, again, if it wasn't within a CMG, it was 20% in 2014. 2015, 150 for non-surgical and 275. If the procedure is done at a CMG, it's $50. If it's done at a contracted ASC, it would be 150 for that procedure. The 275 comes in if it's more in a hospital setting. Inpatient skilled nursing still remains the same, 0 days 1 through 20. ER, the same, 65, waived if admitted. Urgent care, 25. Physical therapy, 30, again from the specialist, from 40 to 30. The MRI, MRAs, CAT, and PET scans, $200 within the CMG. So again, we can control the cost. So if they can have this performed at a CMG, it'd be a lower cost. If it was performed at a contracted ASC or a hospital outpatient setting, would be $300. Your labs would be 0. The 20%, I believe, is if it's in a an outpatient facility. The diagnostic X-rays are 0. The 20% is removed.
And then the diagnostic lab, as you're seeing on the far right of the page, the Cigna HealthSpring Preferred for 2015. As Carrie mentioned, it was 20%. Now that $20 represents if the lab panel needs to be drawn in an outpatient setting or an ASC, ambulatory surgical center, it's only a $20 copay. It's another great enhancement.
Thanks, Ann.
Hey guys, I have a question from one of our remote agents. Question is, if someone has LIS, does Arizona buy down any of the $50 premium for the Preferred Plus?
I would imagine they would. I mean, again, this is a brand new plan coming out, Sean. But I would have to look into it. Again, this isn't a plan of focus for us. This is more for employer groups that, want to reduce the employees that they have on that are 65 plus, and they'll incent them, give them some extra, some buy down money, I guess, if you would, from the employer group to pay the premium on one of these exchange programs. So I would assume, but I would have to double check for you.
Okay.
And I'm just taking a note. I've got the question written down, and we'll get that answer over to you.
All right. Thank you.
I have a question.
You have another question?
Since the plans are changing from 2014 to 2015, of course they're going to have to choose another plan for 2015. Do we do that can we do that for them, or how's that transaction going to happen?
Got you. The question is for our.
Oh,
you can hear him? Okay, go ahead.
Plans aren't changing. Yeah, I got you. It sounds like Paul Madeira.
Yeah.
Yeah, okay, Paul, how you doing, man? Way to bring it up. Okay. So the plans aren't changing. The name's changed, but anyone that was on the Cigna Medicare Select Plus or X Standard plan in 2014 will simply roll over, nothing needed, to the new Cigna HealthSpring Preferred for 2015. Same thing goes for the chronic over to the Achieve Plus. So is that the question?
Yes.
Yeah, they're not new plans, just changing the name.
Okay. So the what's the other one? The Chief?
So the congestive heart plan is removed.
No, it's there. It's congestive heart and/or diabetes.
Okay.
The same plan, changing the name to Achieve Plus
Perfect.
versus Cigna Medicare RX, diabetes heart.
Great.
Okay.
Another question here. Dave, are you there? David? Okay. He doesn't have a mic. I'll have to ask this question for him. His question is, do any of the Arizona plans include the gym membership?
Yeah,
Yes.
we're going to get that in a few more slides. We're going to see the diabetes congestive heart plan, and we're also going to see all the other supporting discount programs and benefits.
Okay, great. Thank you.
Any more questions?
Okay,
we'll move on. Nope. Okay. All right, so medication. So the prescription drug for preferred generics has been reduced from 3 to 0. Non-preferred remains the same at 10. Tier 3, which is the preferred brand, slight increase from 40 to 45. Non-preferred from 75 to 95. And specialties are 33%. Again, I know that's kind of a jump, $20 jump, but we're still right in there with our competitors for the non-preferred brands, the Tier 4. Reminding that Tier 1 and Tier 2 drugs are covered through the gap. I do not know, I only know of one competitor in 2014 that had coverage through the gap. So this is huge for Tier 1 and Tier 2 generics. One change is mail order. We own our own mail order company, and we had offered in years past 3 months for 2 co-payments. It is now 3 for 3. So there is no financial break for using the mail order. However, if they're taking, maintenance medications, it's still a huge benefit for them to utilize the service.
I don't think you guys can discount 0 any more than that, right?
Right, 0 you can't. The 10 maybe. Okay, now we'll go over the Achieve Plus. So again, this is the diabetes type 1 or type 2 or congestive heart plan. Premium remains at 0. Out-of-pocket max slight increase from $5,000 to $5,500. CCP remains at 0. Specialist slight increase from 20 to 30. Inpatient hospital was 260 days 1 through 7 and 14. Will be reduced to 225 days 1 through 7 and 15. Outpatient services is the same as the preferred plan. It was 20% if it was a non-CMG and 14. Now 50 if it's performed at a CMG, 150 if it's at a contracted ASC, and 275 if it's at a hospital, the outpatient procedure done in a hospital. Skilled nursing, 0 days 1 through 20, ER 65, waived if admitted, urgent care 20, physical therapy is 30, the MRIs, MRAs is the same as the preferred plan, slight increase, 200 if it's done at a CMG and 300 at a contracted ASC or hospital. Diagnostic lab is the same, 0 or $20 versus the 20%. Diagnostic X-ray, 0. Transportation is still remains as a benefit on this program, where it's 0 for 24 one-way trips. Generics went from 2 to 0. Non-preferred 9 to 10 and 15. Brand slight increase 245. Non-preferred 95, and specialty 33%. Again on this plan, 1 and 2 covered through the gap, and mail orders 3 for 3.
One thing before I leave this last slide of the benefits, I just want to make it really clear for everyone that we did not change the plans. We only changed the name. So as you're looking at this screen right now, you can see the name change there. And there's your Cigna HealthSpring Achieve Plus plan. That's your diabetes and congestive heart failure.
Prescription drug coverage. One change that we did, or enhancement that we did make, is the pharmacies are basically within the Cigna Medical Group, as well as Walmart and Sam's Club. Now, in 2014, your Bash's and AJ's and Food Cities were considered non-preferred. They are considered preferred in 2015. So basically, there's no There's no difference in cost for purchasing at one of these pharmacies. As a reminder, 0 deductible with our Part D built into our MA, initial coverage limit $2,960, and the true $4,700. So the additional perks, what we're talking, just inquiring about. We've got the free health education classes done at our CMGs. We've got diabetes, self-management, nutrition, healthy eating, chronic disease management, the way to go, Tai Chi. They have smoking cessations. They've got a lot of these additional perks offered to them. Most of the information will be in the summary of benefits. We are also offering Golden Vitality. So we are not offering silver and fit. I think some of the other Cigna HealthSpring markets were offering that and or silver sneakers. We still offer here Golden Vitality. Give them the freedom so they don't have to go to a particular fitness center. They can go to any fitness center and request reimbursement up to $200. Dental is still being offered. Still a great plan, extremely competitive. It is a DHMO, so it is an HMO type, $20 a month. When they see their dentist, they have a $5 office visit, which includes their cleanings and exams. And it's based on a fee schedule. So there is an actual booklet where they open up and they can see the codes to the left. So it's a fee-structured program. We have more than 200 Valley Dental offices to choose from. Look at the bottom, there's no annual maximum. So this is huge. We've got some carriers offering this benefit, basically 1,000 or 1,500 max. So there is no maximum on this program. They can enroll during the AEP. If they don't want to make that decision at that time, they can call customer service and enroll anytime during the year. And they can also cancel. But if they cancel, they can't pick it up again to the new year. Any questions on dental?
Other markets. That's awesome because that's completely different than the markets, the other markets. That's awesome.
Now, when you say
It is.
when you're saying full comprehensive, does that include dentures?
It does. It does. Now, again, so when you look at the dental booklet, it will break down the fees for each particular procedure. What we need to be really careful with, because I've got caught in this myself over the years, is we cannot quote what an exact cost would be. So if you look at the dental guide, the breakdown, again, it'll give a code, it'll talk about the dentures, and it'll give a price to the right. But that dentist may end up billing for that particular procedure 3 different codes. So we want to be careful quoting. To get that denture, it only costs you, $800 or $600, because there may be more that they actually bill. So this is a guide to give to the potential client and tell them they can talk to their dentist if their dentist is in that in that network, and ask them. So my point is that we don't want to start quoting procedures. This is how much it would cost. Gotcha. But it is all laid out. So like if they're getting a crown, it talks about the overlay. There's many codes that are within that billing about that procedure for a crown.
Gotcha.
But there's no cap. So it's a discount program, if you will, based on a flat fee schedule, but they know ahead of time, how much it would cost.
And that all should be in the evidence of coverage, right?
No, I don't believe it's in the EOC. It actually has its own booklet, and it has its EOC or the exclusions at the back of the dental booklet.
Okay.
Don, we can go ahead and send you the PDF of all the materials that we have, and then you can send that out if you guys don't have the actual booklet yet.
Okay.
John, after our call yesterday, John, the CignaHealthSpring.com website, I dug really deep in that. And when you click on the detail of the preferred or the Achieve Plus plan, it gives you all of the PDFs, enrollment form, dental book, directory, full formulary. It's all right there at the CignaHealthSpring.com website.
Got it. Okay.
Thank you.
Thank you.
All right, we're going to show you guys a little bit about the support, which I know you know, the HOW, the HealthSpring Agent Assistance Line, our new websites, and Terry's going to give us some reminders about compliance.
Get all the benefits?
John and team, this is what we're talking about right here. This is your new landing page at the top left corner for the SignaHealthSpring.com website. You can see there that the select the state and select the county are Arizona and Maricopa County. Once you drop those two windows down and select that state and county, you show me all plans. They will populate as you see at the bottom right hand of the screen. Right now, you're seeing the Cigna HealthSpring Preferred HMO. You can see the premium, the copay for the primary care, and the copay for the specialist. That's 0030. Then on the right, see the plan documents with all the English, Spanish, enrollment forms, Golden Vitality brochure, EOC, dental info guide, and more. So from your fingertips, you can access a ton of information. One other quick note, as you were to scroll down in that bottom right-hand corner of the screen right now, where it's showing you the premium, the copay, the specialist, see the plan details right below there where it starts with doctor office visits and then preventive? If you continue to roll down that screen, it gives you almost everything that's in the enrollment kit right there, that quick. So this is a wonderful new feature. Also, as you guys are used to using HOW, that's 1-800-973-9183, option 2. If you guys want to send in any email communications, you would send it to the AZ Senior Brokers at Cigna.com email. The hours of operation for HOW are going to be, we're looking at AEP, 7 a.m. to 8 p.m. for Central Standard Time. You can see we have our mountain. You guys are all good to go on that with your time zone. And then I believe we already have our telescope line, and I believe you might be recording another way, but there's the phone number if we are using the telescope for our scope of appointments.
Got it.
Next, this is our new paper scope. I don't know if we're using that, but we're just showing you we do have a new 2015 scope of appointment form here. Then also the application submission time. Again, this may not apply to you, but we all know that it's 48 hours. I think you guys are all hitting the mark on this, so that's just a quick reminder. I don't believe this applies to us either, as we are submitting our applications and recording everything telephonically, putting the telephonic recording number in the signature. And so, I don't know if are we faxing them, John, or?
Right. Actually, Juan and I were just talking about this. So we are still paper for you guys aren't on Cigna HealthSpring's portal for the e-agent, right?
Not yet, no.
Okay. All right. So yeah, we're faxing.
Okay, so if you're using paper, we're just going to look at the number 1. So here's where it's going to be right here. We're going to fax it to this number, and I'll speak more to that in just a moment. The biggest thing is, since we are collecting that paper, we'll go right back to that rule. 48 hours is the time that we needed to get in. And then here's the fax cover sheet. So, John, are we using this?
Yes.
Absolutely.
Okay. Perfect. So once you get your scope of appointment, there's your recording number right here. You're going to put your agent ID up here, very important. That's for your name, and the rest of the information you can complete there. And it is required in 2015, which I believe you guys are already following. Once you complete your application, you've got to have that scope of appointment number recorded there as well. Okay?
For telephonic, we just write telephonic.
You hear
That's
that?
the only
That
place.
telephonic is going to have a confirmation number. So when you record the telephonic scope of appointment, there will be a confirmation number that is given, and then you'll simply write that.
Yeah, we don't do that. Basically, the way we address scope of appointment is we disconnect and the caller calls back in, so there's no separate call to the scope line.
Miguel, this is one. Yeah, that's our attestation.
And maybe. I'm sorry.
I'm sorry, Miguel. This is one. That's our attestation for call center. Is the disconnect. We don't actually submit SOA. I mean, with the actual app.
But yours
Okay,
is
very
recorded.
good. Maybe just
Correct.
indicate,
Yes, I call it
just to have some sort of format. Perhaps just right over here, telesales or whatever you guys do. What is it called, John or Ron? Is it telesales or what are we writing here?
Yeah, on the actual app, we put telephonic at the signature.
Very good. I think okay, very good. I think we're good then. Okay, so we'll just use your fax cover sheet with the other information needed, and then we'll let Carrie give us a few reminders on compliance.
Okay, thanks. Enrollments, I don't know if this is going to pertain to you guys so much, being telephonic, but enrollments between October 1st through October 14th, we're just reminding the agents that we cannot encourage them to fill that out at this time. And, for agents that put feet on the ground, they go out and see them during this period. Really, basically, all they can do after going over the plan is have their agent number at the bottom of the application. No signatures, no dates. But again, this would not apply for you guys. RMA is our regulatory management and administration. Again, I don't know how they're going to do with the telecenters, the telesales centers. But what they've been doing is yearly or annually trying to reach out to some of the agents and do mock presentations. So I'm just kind of giving them a heads up that they're out there. We have done very well locally here in Arizona with no major discrepancies found. So Anthony and I are very, very proud of our agents. However, there were some issues, and they were slight, that was brought to our attention that I just wanted to share with all the agents. One of them was, being able to explain the difference, or not the difference so much, but what calculates towards the initial coverage limit and or the troop. So just making sure everybody's on the same page. The ICL is calculated by the full negotiated cost of that medication, meaning what the client would pay as well as the carrier for that particular medication. The troop is the total cost that the customer pays out of their pocket. But when asked by this evaluator what all is calculated within that troop, a reminder is when the potential client gets within that coverage gap period, or the donut hole, it's the entire discounted cost as well for that brand name medication. So they're paying a percentage and it's being discounted by the manufacturer. It's as if they were paying that entire cost. So 100% during that coverage gap goes against that troop. Is that everybody's understanding? Anybody have questions there?
Nope. Okay. I'm good to go.
Good. Another one that was kind of detected, I guess, was we are allowed, we have to be careful how we ask if someone qualifies for a CSNP, because we don't want to look like we're cherry picking. So instead of asking somebody, if they call in, say, Chance, do you have congestive heart or diabetes to qualify for a plan that Cigna HealthSpring offers in Arizona? We need to turn it around and we need to say, we have two plans to offer Medicare beneficiaries in Maricopa County in Arizona. We have the Cigna HealthSpring Preferred HMO. We also have the Cigna HealthSpring Achieve Plus HMO for customers that are diagnosed with diabetes type 1 or type 2 or congestive heart. Would you by chance qualify? Would you qualify for that program? So instead of outright asking them if they have the condition, we say we have a plan, specific for individuals who qualify for that chronic disease. Same with medication. Granted, yes, we want to make sure that those medications are covered before we close the sale. We cannot outright ask them to give us all their medication names. What we can say is, would you like me to show you how to look up your current medications within this formulary? Or would you like me to go over your medications to see if they're covered? We have to ask them that question instead of asking them to give us all the medications that they're currently taking. Any questions with that?
No. Good to go.
Okay. SDAC, I think you guys are familiar, which is a sales development team or committee that we have. Basically, they're put into place to prevent violations, to detect them early, and see how we can, educate that agent and make them compliant moving forward. So if you do commit a violation, that information goes to the SDAC. It most likely will come to Anthony and myself first. Once the SDAC, if it's a huge violation, they'll make the decision, and it can be continual training. So a lot of things come out of this really to protect the agent. We want to make sure, to keep us all compliant, that we are truly going over the summary of benefits. We need to compliantly explain the Part D formulary, explain the tiers, explain the acronyms. What is a prior authorization? so that when they look at the book, they know how to read it. Explain how to find generic versus brands. The brand is in caps, and the generic is in, Enrollee, we need to ask them, Enrollee was asked if they would like the agent or broker to verify their medication. I'm sorry, I got some background noise here. Explanation provided on how to obtain the full listing. So if they ask, we have a formulary that is built into the summary of benefits. If they ask for the full comprehensive formulary, we need to tell them where they can go to get it. They can go online. They can call customer service. Again, what is in the summary of benefits is an abridged formulary, which is the majority of medications that the beneficiaries are taking. Provider directory, again, we need to make sure that we're going over their PCP and specialist. If we're talking about the CMG, we need to be able to explain to them if they're going to be referred to a specialist, especially a cardiology group. And really I like the layout in the provider directory this year. You see in the beginning, it segregates each group of the CMG. So you've got West Valley, North Valley, Central, East Valley, and it'll tell you right there who that group will refer to as far as the cardiology pod. So I think that makes it easier for us to explain that. So we need to be able to explain if they were looking up their cardiologist. We know they're contracted with Cigna, but if we put them with the CMG, we got to make sure that that's a pod that they'll be referred to for cardiology, as well as specialists that are built into the CMG. Now, these IPA physicians, the outside IPAs, can refer to any contracted physician and or facility with Cigna. And then again, we need to tell them, and we've got a provider book, but we all know they're outdated the minute they're printed. So we need to be able to explain to these, prospective clients that if they wanted more information on providers, how to look it up or to contact customer service to verify if a physician is contracted. Make sure that we're using CMS-approved marketing materials. Make sure that we're getting the appropriate scope or recording it as you all do. The enrollment form, ages must properly complete it. If we are enrolling in the CSNP, the chronic SNP plan, that verification form must accompany the application. A lot of people think they can turn in the app and they get that form signed later. It's a part of the application. So it's considered a pending app and it will not be processed without that verification form. We need to make sure that we have the physician's information on the form as well as an appropriate fax number for us to fax out to. We need to explain that they have an FEP. So as you all well know, they can get on the plan prior to verification once we've sent the attestation request to the primary physician or whatever physician. We need to explain to them if this comes back without an attestation, you would have to be removed from the plan, but you do have an SEP to join another program. Or if they're on our plan and they somewhere down the line lose the eligibility for that program, that they would have an SEP to move to another Medicare Advantage program. We must state that per CMS. Make sure that we review the statement of understanding and the out-of-network coverage, as well as the lock-in statement.
Okay, some marketing efforts that we've put forth here. This is our pre-AEP campaign. This began September the 1st. These are some of the colorful branding messages that we've been getting out there, and one of the biggest messages is better health, better value. Next, we're going to have these marketing pieces available. John, I think you guys are pretty much leading this with your mail drops and so forth. Do you guys really use flyers?
Not as much in our call center.
Okay, got it. Well, just letting you know what your field on the team here is using, so you can just see that's really quick. And then also some of the seminars, it's the same message, but there's seminars also available for your team in the field. And then we finalize with certification. John, I think everybody's certified, correct, on your team?
Correct.
Yeah, so everybody's completely done. You know the certification website. You know the requirements that needed to be completed as you're seeing here on the screen. We are saying, yes, we're all 100% complete. Great. And then your commissions and so forth. There's your 408 and your 204 splits. So with that, folks, it concludes our 2015 broker rollout meeting, and we'd like to open it up for questions.
The vision, can you go over the vision a little bit, please? You get that, Anthony?
Yes, you're going to have some vision. You're going to have some vision coverage when you get into the, we call it the enrollment kit now, because everything is all inclusive into one little booklet. So when you get into that booklet and you get to the part of the summary of benefits, you'll roll into that and you're going to see that there's routine vision eye exam, which is going to be $0. That's every other year. That'll be covered. But then also, if a patient needs to see an optometrist or an ophthalmologist for a diagnosis or something, that will also be covered. We do not have any allowances, but also following a cataract surgery, there will be a $0 copay for lenses and contacts and things of that nature. I guess the other big thing to add to the vision is that there are a selected number of facilities where they can go, and it's all within the Cigna Medical Group. So when you get your provider directory and you get back in the page like 325 or something like that, or maybe a little bit closer to 280 something, you're going to find the vision facilities or centers where they can go for those, to utilize those benefits.
Okay. Any other questions? Let me just check real quick online, make sure none of our remote agents had any questions here. Okay, Paul?
Miguel, this is Paul again. In the Phoenix, Arizona area or the Valley, are there going to be any meetings or any seminars for beneficiaries to go to?
Yes.
Okay.
So I guess there's two parts to that question, I think. The first is we're doing member ed events right now. So if you're talking about your customers you guys already have on the books, yeah, we're out there, we're meeting with them, we're letting them know what's happening for 2015. The overall response has been very, very positive. So retention, of course, is the first thing at hand. Now, secondly, if you're talking about marketing seminars where agents go out and do public speaking, to do presentation, yes, those are also happening.
All right, so here I have another question from an agent online. He's talking about customers going to non-CMG. He said that they can only, the question is, if they go with the non-CMG, they can only go to non-CMG specialists?
No. So the way we want to draw this out, I usually use an image when I do this. We have one large network with a choice between two groups for primary care. And then below that, once I spell that out, let's say they make a decision over on the IPA, the non-CMG side, I put a little parentheses with open. The open represents that it's one large network, so I can access over 5,100 specialists. I can access 40 hospitals and all of the facilities, so it's open to them on that full network. There are some CMG versus IPA services, and they also overchange. So let's say you choose an IPA, and you say, well, you know, I want to see my doctor within the Independent Physician Association side, but, you know, they don't have a lab on site, so I'd like to go over here to the Cigna Medical Group because it's right where I live and have my labs drawn. And while I'm at it, you know what, I might use the pharmacy at the CMG. So everything is very interchanging. And the big note is, like Terry was telling you, on the Cigna Medical Group side, sure, you've got to take some notes to know how the cardiology pod works and some of those specialties. But as soon as you go to the non-CMG IPA side, the one word to remember, it's open.
Okay, let me just check with him, make sure. All right, folks, any other questions online from our remote agents? Okay, looks like we're good to go, guys.
Great job, great job.
Thank you, Miguel.
Thank you.
Hey, thank all of you. Really appreciate appreciate you guys taking time out of your morning today. We want to wish you a very successful AEP. We hope to get some things really going well with Cigna. So Carrie and I are available. Please use our phone numbers or emails. We'd love to hear from you and get back to you.
Perfect.
Thank you, guys.
Good deal. Thank you. All right.
Thank you for all attending.
No problem.
Okay, bye-bye.
Virtual agents, hang in there. Don't disconnect yet. Mark had a couple of things he wanted to go over from compliance standpoint, so please hold on. Mark, if you're online, come on back and do your thing. There he is.
Okay. Anybody left online, Tom?
Yeah. Still have 22 people on there.
Okay. Oh, wait, oh. Here? My one?
There's no camera.
No camera, okay. I got to get dressed then. Yeah, John covered a couple of the points I wanted to bring out when we were, I guess, let's go back to the lead pieces that we worked. A couple of concerns, although we did cover them. Two things, as you know, I'm listening to a lot of recordings, especially for new people, the recording statement. Every single call you have to have a recording statement. This is an FCC law. It comes under wiretapping. We're recording every single call, so you can't talk to somebody without getting their consent. So you can't just wait until they call back for the enrollment because you have the recording statement there, and your whole initial telephone call has got to be right up front. Take a big sign up, put it in front of you. You got to remember to do that. If we have an issue where there's a complaint or something, again, that it's the call center is great, but compared to the field where nobody really, it's I guess what you're saying compared to what a client might say, the call center, everything is recorded. So any type of complaint, every call is submitted, and if they're listening to a call and there's no recording statement up front, even though everything else is okay, they automatically, you're in violation there. So it's very important. You just have to get into that habit of every single call, even if the client's calling you back to just talk about anything, every call is recorded. I don't know if you remember the Monica Lewinsky thing and all that stuff, but it's a major issue that you know, this isn't so much a CMS thing. It's more of a federal FCC kind of violation for you know, not getting a permission for somebody to let them know that you're recording the phone call. The second issue too, our lead pieces, again, these are not Cigna HealthSpring BRC leads. So it's imperative. I hear people where they're calling about a veteran lead and you're not addressing the lead sometimes, you go right into, well, what do you have for your Medicare A and B? Again, that sometimes we've had issues where that could be almost like a little bit of fraudulent, where we're sending a marketing piece out, somebody's calling back in, you're not even discussing the aid and attendance, the whole purpose of the lead piece. You're going right in to start discussing as an insurance agent, right into asking about their Medicare A and B. So you need to address the lead piece up front. Again, you'll see once you start working these, 99% of the people don't qualify, so go through here's the requirements of our marketing piece, and then go into, you know, discussing about their, you know, what do they have to help with their Medicare coverage. That also leads me to the other issue that we're having. If you remember, you just finished AHIP. You need a scope of appointment. Even though it's telephonic, you have to create a verbal scope of appointment. Our lead pieces are not BRC. Somebody's not calling in asking about Medicare Advantage. So you can't just, somebody calls in about a veteran piece and then you're saying, well, we have Cigna HealthSpring in your area. You have to go through the 4 parts of Medicare. You know, up front, here's the generic, here's the way Medicare works. There's 4 parts of Medicare. Here's how Medicare Advantage works. There are 3 qualifications for a Medicare Advantage. Ask them about the qualifications. If they do qualify, oh, well, Mrs. Jones, there is a plan in your area that I could tell you about. Would you like to hear about that? You need that scope of appointment so they're giving you permission to discuss plan specifics. So we've kind of gotten off track with that. I hear that a lot where people go right into, I've got your Cigna Health Spring right in your area with a zero premium. And again, with a Medicare or a VRC from Cigna Health Spring, that's okay, but our lead pieces are not Medicare specific, by nature. So you need to look at these scripts, again, go through the basics fact finding, what they have, and then go through a generic, here's how Medicare works, the 4 parts of Medicare, discuss generically how Medicare Advantage works, again, and then ask them, would you like to hear, there is a plan in your area, would you like to hear details about that? That's creating your scope of appointment. That's it.
Thank you,
Good job, Mark.
Thank you, Mark.
Okay.
All right. Well, thank you again, guys. I know this is a long meeting, but I appreciate you hanging in there. I think it was great information. For those of you out there that have, that received the Arizona BRCs, you see what the plans look like. We should be killing it with these leads. These are folks that are calling specifically asking you to tell them about the Arizona Cigna Health Spring plan. So you can go, contrary to the topic we were just discussing as far as global premier benefits leads, the Cigna BRCs, you can go right into the plans because they're calling, they are specifically asking about the Cigna Health Spring. That is a Medicare Advantage lead, okay? So, with all that said, folks, thank you again for joining us. Let's have a productive day and talk to you soon.